A very good morning to you. It is another beautiful Friday. Welcome to Lifestyle Friday right here on Family TV and Family Radio 316. My name is James Okumu. Thank you for taking the time to hook up with me today. Now, today we have an interesting topic we want to explore and discuss and gain knowledge because, my friend, knowledge is very important. Endometriosis. That name is hard. I've been reciting like the last 3 days how I'm going to pronounce that name, but endometriosis is what we want to talk about today. Many of us not aware of what it is. Some of us became aware of this when Njambi Koikai, was all over the media, on social media, and she decided to share her situation and her journey with the rest of the world, and we've been following her story, and many of us got to know about this condition through her updates and through her telling us what she's going through and how she's faring on. Well, she will be joining us on the show today. We also have a doctor who will be joining us from Mombasa as we get into this discussion to find out what is endometriosis, how does it affect people, and is there treatment for it? What do we need to know? I was shocked to find out that 10% of the women worldwide, 10%, that's a huge number, my friend. That's a huge number of women to be affected by this issue, and then we are clueless about it. And so we thought, let's talk about it, let's create awareness about it, let's give information about this condition so that we may be able to know what it's all about and know how to help those who may be having this condition. So that's the discussion we are having today on Lifestyle Friday right here on Family TV and on Family Radio 360. Lifestyle Friday, here we are again. And today we want to talk about endometriosis. In studio today, I have got two amazing ladies who will help us get a deeper understanding of what this condition is all about. First and foremost, we have Njambi Koikai. Njambi is not new to many of us. We have been following her story. Njambi is a broadcast journalist, and she has survived stage 4, thoracic endometriosis. Hey, easy Majina. Njambi, how are you doing?
Thoracic. Yeah, thoracic.
Can't they just make this?
I'm doing well, I thank God. And good morning.
Good to have you on the show today. Karibu sana.
Well, asante sana. It's such a pleasure to be here on Family Radio.
Great. We also have Dr. Swabra Swale Break. Daktari, how are you doing?
I'm good. Pleasure being here.
Good to have you as well. Mombasa jua limewaka ama kunanyesha?
Moto kila siku.
Karibu sana, good to have you. Maybe Daktari, you can begin by explaining to us endometriosis. What is it?
What is it?
Yeah.
So endometriosis, simply put, is where the endometrial lining of a uterus or the endometrial glands are found outside of a uterus. So if we go back to our biology, sote tulifanya biology, sindio? Good. So tukirudi biology, ukiangalia ndani ya uterus, okay, the layer that bleeds every single month, that is under the influence of hormones, that sheds off every single month. Now, those cells can be found elsewhere. It's almost like, witchcraft, but they can also be found elsewhere, okay? Yeah. So they can be found in the bladder, they can be found in the rectum, they can be found in the brain, they can be found, as in Jambi's case, in the thorax or on the chest. So it just depends on where we look for them and where we find them.
How do they get to these other places?
Still baffles us, and if I say that we know, and
nobody knows.
Nobody knows. There are several theories, though. There are several theories. As with science, if they don't know anything, usually we say they are theories.
Yes.
So the theories are, we have what we call retrograde menstruation, meaning when you are having your periods, instead of a period coming downwards through the door into the outside world, they actually go through the tubes and to the rest of the body, because the tubes actually connect the rest of the body. So there is a theory of retrograde menstruation, but it's not quite been polished on. Yeah.
Okay. So when these cells are found elsewhere, what happens? What makes it affect the body?
Good. So you see, these cells, they're special in the sense that they respond to hormones. Every month they respond to hormones. Yeah. So every time this hormone is released at certain times of a month when you're about to menstruate, everywhere where you find these cells, from your womb to outside your womb to wherever they are all responding. It's like they're all jeshila, hormones.
Yeah.
So every time we say go, they're all going, okay? So that means you're bleeding from micro areas all over where they're found.
Wow. Njambi, at what point did you know that this is what you're suffering from?
First of all, it's important to note that it takes between 7 to 10 years to diagnose endometriosis.
What?
And yes, it takes between 7 to 10 years. Yes. I started menstruating when I was 13 years old, and from the onset of my menstruation, it was pain and pain and pain. And at that age, at the age of 13, my mom and my late grandma took me to the gynecologist. And they said it was normal, the pain was normal. And then later on, the pain advanced, and I was taken to the gynecologist at the age of 15, and they put me on birth control to manage the hormones.
Yeah.
And that should never have happened, because once they put me on birth control, the pain came back worse.
Ooh.
So I told my mom, I don't think I would want to see a gynecologist again. So I stayed on until, you can imagine, from when I was 15 to 2015. That was about 17 years later.
So all these years you were in pain?
Yeah, 17 years later. So I started experiencing, I was always in pain, always. I have lived around and in pain.
Oh my goodness.
And it's not pain, it's not normal pain. It's apocalyptic pain. I'm talking about pain whereby I'm not able to walk, periods, I'm vomiting, and it's serious vomiting until I feel like I'm vomiting my bile. I have, a running stomach, I'm bleeding heavily, I'm anemic, and, very many instances, I had to mix concoctions of different painkillers so that at least I was able to be free of pain, but those still wouldn't work. But in 2015, I was working for a private media house. And I remember going up the stairs one time, and I started wheezing, and I felt serious pain in my right side of the chest. And that went on for a week. And my mom was like, no, this is not normal. Let me take you to the hospital. So we went to hospital, and I was on my period. And they did a chest x-ray. And the doctor came back with the results. The radiologist came back with the results and said, hey, I'd like to know who you came here with. And I said, I came here with my mom and my grandma. And they said, okay, you can't go back home today because you have collapsed lungs. And I was like, collapsed lungs? Like, how does that happen? Well, so they thought I was in an act. The theory they came back with was that I was skinny. So they said, I'm very skinny, my lungs are elongated. I've never really quite understood that theory though. But so they asked me to stay on and check into a hospital and go straight to the theater because my lungs had collapsed. And so the theory was I was skinny. So after I came back from hospital, so my mom started cooking, and they really started cooking. And every morning it was like, we're having like different types of food. It was like a buffet. Our house became a hotel, but I still wouldn't eat. And then the second month it happened again. So, I was seeing a chest specialist, and they just couldn't, it was baffling them as well as to why this was happening. And that's when I started going through all these surgeries. At the same time, my grandmother had been diagnosed with pancreatic cancer stage 4. So I told my mom, okay, so this is what we're going to do. So we have 2 chronically ill people in this house, and we're running out of funds, and then I just lost my job. So I said, okay, I'm going to fundraise for my grandmother first, and then God is going to help me. I'm going to survive somehow. So I went on TV, and I was talking about my grandmother, and I was coughing, and I was talking about, what I'm going through. And then this lady, God bless Cindy, she texted me on Facebook, and she said, I think you have a similar problem to what I have, and this is a reproductive healthcare issue. And I was like, what do you mean? And she said, I'd like to send you to my gynecologist, Praful Patel. You can go and talk to him at Aga Khan, and he'll definitely be able to give you a diagnosis. So I went to him, and that was after about 18 surgeries.
Wow.
That's when I finally got a diagnosis after 17 years, after 8. And I was able to finally understand that this was actually just because of periods. So like Dr. Swale said, the cells had moved to my lungs. So every month while I was on my period, those cells used to bleed into my lungs. Ooh. And so what would happen is the lungs would collapse, they'd be filled with fluid, water, blood, a lot of air. And so they punctured my diaphragm and punctured my lungs. And so they needed to insert tubes so that my lungs could expand.
Yeah.
I went through that 18 times and nobody ever told me that it was thoracic endometriosis.
Oh my goodness. I can't even imagine.
Until I found Dr. Patel.
I can't even imagine the pain and the anguish
Yeah.
and the not knowing. And every month you're thinking, okay, here we go again. Dr. I'm wondering, what causes this? And is it something that we can say is it hereditary? Dr. Are you with us? Ama you've gone off to see a patient. Is Dr. with us, or Dr. has left us? I think that Dr. is having challenges. So maybe Njambi, we can just continue with your story. Dr. will find us along the way. Hapo Githurai tukiendelea na safari yetu. So once you got to discover what this is, what was your next step? I mean, how first of all, how did you feel about it, and then what did you do next?
Yeah. First of all, I was very disappointed at the fact that I was very disappointed and sad because I'd gone through so much pain for so many years silently. And I mean, people used to see me on TV, people used to see me performing on radio, but nobody really knew the pain I was going through. And I'd say I had mixed reactions. I was disappointed, and I was also happy that finally, you know, this thing had the name to it, you know?
Yeah.
And I was just hell-bent on finding help. And then when Dr. Patel told me, because he just broke it down for me, he was very honest with me, and he said, you know, Jambi, there's no specialist in this country, not on this African continent, who can help you.
What?
So you need to leave this country as soon as possible, and you're very, very critical. Yes. So I was like, what? Yeah. Then he said to me, yeah, I can't even help you. I can't even touch you. Like, I can't. Your case is beyond.
Oh my goodness.
I can't. Like, he just told, yes. And he was like, you need to leave this country as soon as possible. So we started looking for doctors.
Sorry, is it because...
doctors, and we found doctors in the state.
Sorry for cutting you short, Njambi. Is it because it had stayed for too long without being attended to?
No problem.
Is that the reason why Dr. Ali was saying even him, he can't touch you? Or was it that your case was too severe?
It's not even about the length of time or the severity of the disease. We just don't have specialists who deal with endometriosis in this country.
Okay.
We don't. So whether it's at stage 1 or stage 4, we don't have that we don't have doctors who are specialized in the treatment of it. And the treatment, the treatment for endometriosis is through a surgery called excision, not ablation. So excision is where they cut out the root cause of the disease, which is not done here and is not done anywhere in Africa. And so we have to seek medical treatment abroad.
Yeah.
So that's why I had to go to the States. And the cost of treatment was out of this world, so I had to free because we're also not covered by insurance companies, which are termed as a liability. And because they say this is a pre-existing condition fundraise. But I'm forever grateful for Dr. Patel, who, you know, he was very...
We seem to be losing you.
Very, very honest with me, very honest with beyond me. Yeah, rather than having to do the same thing over and over and just extending the severity of the disease to even other places. And I'd also like to say endometriosis is a full body disease. It can go anywhere in the body, like that Dr. Ari said. It went to my intestines, my appendix. I don't have an appendix. That's they removed it. It went all the way to my teeth.
To your teeth.
I had to go through a dental surgery when I was in the States as well. Yeah. So those are some of the symptoms people should always be very careful about. Like when you're brushing your teeth and your teeth are bleeding during your menstrual period, you have to be very, very careful about that. You know, tell your doctors about these things. Because I'd been having dental issues for a long time, many, many years. You know, my teeth would bleed, my teeth would weaken. I had to wear braces for 5 years.
Yes.
And then we didn't even know it was endometriosis, you know?
Wow,
Yeah.
wow. Dr. Ari, are you back?
I'm back. I'm so sorry. This technology.
Yeah, and you're back and you're upside down.
Yeah.
And you don't say. Okay, fine.
There you go.
Thank you. Yeah.
For a moment there, I thought you had gone to attend to a patient.
No, a call came through and I think just disrupted everything.
Sorry. At least you're back.
Yeah.
I was asking earlier on, what causes this condition, and is it hereditary?
So there is a theory that, yes, you could carry endometriosis from family members, okay? Maybe someone had it in the family and all, but mainly it's sporadic happening, okay? It can happen to anyone, and it shows itself immediately you start your period. So I think I caught the first bit of Njambi's bit where she was saying immediately she started her period, her periods told her that she had endometriosis. So it's not a disease of the elderly, it's not a disease of, middle-aged women. If you have a family history, yes, you're more predisposed, and yes, it shows immediately.
Okay. Jambi mentioned she had stage 4. Does it mean there are different stages, and if yes, what are the different stages?
Oh, okay, fine. So in terms of staging, from 1 to 4, it's just basically how severe and how spread out it is. So we're basically looking at how far from the uterus it is, and then how big can you hear me? Yes. And then how far from the uterus it is, how severe it is, and how my calls keep coming in. I should have just picked another anyway. And just basically how big the endometriosis manifests itself as, simply put. Yeah.
Okay.
So stage 4 being the most severe, stage 1 being a bit more forgiving.
Okay. Now, giving you an opportunity to ask questions today as we continue with our discussion for today, just getting a deeper understanding of what endometriosis is all about. 20316 is the SMS line. WhatsApp number 0786 316 316. It is Lifestyle Friday. Eden Tea, finest garden tea. Have you had your cup of Eden Tea today? If you haven't had your cup of Eden Tea, my friend, kunywa kachai. It is good for you. Eden Tea is the finest garden tea, and Eden Tea is reminding us in this season that together we can flatten the curve, the COVID-19 curve. How do we do that? Wash your hands with soap and running water, my friend. Watu waendelee kuosha mikono. Put on a face mask. Si ya kuficha ndevu or the lack thereof. It is for your nose and for your mouth, my friend. Put it on and put it on well. Kenyans, we are very interesting. We don't do, but we pretend we are doing. You know, you walk around the town and a lot of people have got a mask, but iko hapa kwa chin, and you're wondering, so what are you protecting there?
Near police.
So Eden Tea is reminding us, wash your hands, put on your mask, maintaining the personal distance, because that's how we will flatten this curve. Eden Tea, available at leading outlets at affordable prices. If you haven't tried it, try it out this weekend. You will not regret it. This morning, we are talking about endometriosis. We have Njambi Koikai in studio with us via Zoom, and also Dr. Swabra Swale from Mombasa, and they are giving us information about this condition. So I'm just wondering, Njambi, you said earlier that the whole of Africa, there's no one who can offer treatment for this, and if one out of every 10 women have got this condition, does it mean you have to fly to the States or to Europe to get treatment? And is it expensive?
And it's very, very expensive. And unfortunately, I don't say it's an African problem, it's a global problem. Because when I started learning more about endometriosis, I joined in, a lot of support groups, a lot of women who are battling thoracic endometriosis. That's endometriosis in the lungs. And I later got to find out that this is actually a global problem, because even American women are going through the same thing.
Yeah.
European women are going through the same thing. So it's really not an African problem. It's a women's issue. It's a women's issue. And I think reproductive healthcare is never prioritized. And of course, these are issues that come about due to patriarchy in medicine.
Yes.
Because if you have 1 in 10 women battling this disease, that's a huge number.
That's a huge number. Yeah.
Worldwide, those are 200 million women. Yeah, that's a huge number. So, it's a very, very expensive disease to treat. American healthcare is not like Kenyan healthcare. It is so expensive. I can tell you that, when I went to the States, I had no insurance, and as you're all aware, I had to do I had to run a public fundraiser.
Yeah.
And then when I got there, I developed complications and I stayed on. We thought it would be done by a month, and come back home. I stayed on for a year and a half, going through treatment and other surgeries. And the cost of treatment is out of this world. It's like a whole CDF budget,
Yes.
And even as you watch on TV and you see Americans complaining about healthcare, their healthcare is way out of reach for so many people. So those are some of the things I'm trying to raise awareness on in this country, because first of all, we need doctors trained, we need specialists, and we also need insurance to cover for our healthcare issues.
Yeah. Dr. I'm just wondering, what happens if this goes untreated?
What happens if endometriosis goes untreated?
Yeah.
So maybe you had asked earlier about the severity or the staging of. Let's remember that there's a woman walking around with endometriosis, totally undiagnosed, totally not
unaware,
presenting with any symptoms, unaware of it, and it does not bother her. She does not know. And then there is on the other spectrum where it has come out mightily, like in Jambi's case. So I guess if it's left to its own devices, we could progress on the spectrum from the asymptomatic, without symptoms, all the way to full-blown endometriosis, depending on where it is. So basically, with endometriosis, if left untreated, I usually look at it from the endpoint of quality of life, okay? Because it's not a disease that I can go and say, okay, this is malaria, let me treat malaria. Or this is this swelling, let me remove this swelling.
Yeah.
Endometriosis is very diffuse. It's neither here nor there. You cannot say that I'm removing your uterus because the things are not even in the uterus. They're outside of the uterus. I cannot say that I'm taking out Jambi's lung. So you can't quite treat it, you just manage it. And so eventually then it will be best to approach it from a quality of life point of view, in that don't let it get to be so bad. Yeah.
Okay. I'm just wondering, since it's a condition that relates with the reproductive health, does it have any any effect on childbearing?
Absolutely. Actually, the numbers are 1 out of every 10 women have endometriosis, just generally. But of the patients that come in with infertility issues, we know that 70 to 80% of them will definitely have endometriosis, and studies have been done. So we know that the biggest cause of infertility is what? Endometriosis, amongst other causes. So there is an impact, a direct impact and correlation. How does it cause infertility and prevent childbearing and all that? It goes for your tubes, depending on where the endometriomas and small cells are. They could be in your tube, and so they kind of cause a direct blockage of the tubes. Okay, if you'll allow me to probably demonstrate, I have a bit of a. So if this is your uterus, right? This is your uterus, and we know that this is your endometrium, okay? The layer that is supposed to normally shed. So we could have endometriosis right where it's not supposed to be, somewhere there. We could have it somewhere there. We could have it somewhere there. As you can see from these dots, we could have it somewhere there. So depending on where it is, okay, it could actually directly block the path or the passage of all these sperms and eggs meeting, okay? So yes, it does affect fertility.
I'm just wondering, for the percentage that actually are able to conceive and yet they have the condition, does it have any effect on the baby?
No, it may not so much have an effect on the baby in the sense that the baby will grow normally. But yes, genetics still apply. You might have endometriosis and pass it forth.
Okay, Jambi, back to you. You say your treatment took 1.5 years. Why? Why was it that long?
Because I developed a lot of complications. As you remember, I had gone through 18 surgeries here. And so the disease had spread to other areas, especially in the lung. It had eaten up my lung. And my lung was in severe condition. So every time we did the major surgery on March 1st, 2018, in a surgery that took 12 hours. And then later on, I was in isolation. And you know, my lungs the doctors kept on finding pockets of water. I'm sure you've seen that picture on Facebook where there's so many tubes. I had a lot of tubes inserted. So essentially what happened was, when I came out of the operating room, I didn't have all those tubes. But a week later, they kept on finding pockets of water everywhere. So they had to drain all those. They had to drain them. So they'd come, they'd do an X-ray every single day, and they find water everywhere until my chest cavity was filled with tubes. And they said, now you have to choose, you know, either we put it in the back or now we put one last one in your chest. And I said, you can't put it in the back because now I sleep on my back. So just put it on my chest. So I had 5 chest tubes, you know, at one point, and I had a catheter as well. I developed a lot of complications because, like I said, the previous surgeries that were being done without any knowledge of what the disease was.
Yeah.
So every time they pushed the tube, they were pushing the disease further and further and further, and it was just eating up my lung to a point whereby now they had to cut out part of my lung and graft it. And that was a very, very sensitive operation. So I stayed on, and also I needed to stay under observation because my lungs were in a very, very sensitive state. I'd also gone through excision surgery in my uterus, and I'd gone through, they also cut out my appendix. They also found water in my stomach, which they needed to drain out because of the endometriosis. It had also completely eaten up my abdomen. But I never really focused on that pain because I was used to that pain. So the pain that I was really going through was in my lungs. So I stayed on, and then right before we came back, we were planning to come back home January 2019. And they also discovered that I had another air pocket that needed to undergo surgery. So I went through another surgery, and that's why it took that long. But I was going through the treatment, which I said is excision surgery, and I was under observation. And I'm grateful to God. I've never been sick again. I've never had a lung collapse ever again.
Wow. I'm just wondering how many, two questions in one. How many surgeries in total have you had? And what kept you going? Man, that is too much for one person.
Yeah. I've gone through 21 surgeries.
Ooh.
And yeah. I've gone through 21, and I'm such a tiny girl. And at the time I was 36 kilograms. Can you imagine?
Wow.
I was completely frail. I'd say God kept me going. That's all I'd say, because I had no strength, absolutely no strength. And my mother's prayers. During that whole process, we lost our grandmother. So I kept on saying, I have to keep on fighting for my grandma, who used to call mommy. We lost her, but I had to keep on fighting for my mom and my sister.
Yeah.
That has been my support system ever. So, and I just give God all the glory because of the courage He gave me. Even in the midst of that situation, I was so courageous. Like, I never used to cry. I never cried, never. Yeah, I only cried once. And I cried because I was like, no, this is too much. Like, this is not ending. I wasn't crying because of the pain. I was like, no, I think anyway, God, tumengangana sana sasa, Yeah, wow. So, but I thank God for the strength.
Okay. Daktari, I'm just wondering, is it that there isn't a lot of awareness about this condition? Because Njambi mentioned she underwent quite a number of surgeries before she actually was able to find somebody who told her exactly what she was going through.
What it is.
Is it that
I will bring it down.
There's not an awareness about this condition?
There isn't, and it will boil down to our healthcare system and what we have invested in, because you see, at the end of the day, you reap what you sow. So here's a system that is refusing to train specialists. Here's a system that at first contact, the normal Monanchi will probably not see a consultant, will see maybe a junior doctor or an intern. And so the default usually is not to tease out the bigger issues, we tease out the smaller issues.
Yes.
You come coughing, I'm tempted to think, we live in a TB endemic area. I'm sure Njambi has been treated for TB at some point. You come coughing blood. Yes, you come coughing blood. I'm thinking, you have blood in your lungs. I'm thinking, let me first drain out. Even though I don't know what I'm treating, let me first drain it out. So by the time you make contact with someone who's thinking beyond and who has the ability to tease out all these things and who has the ability to dissect and one by one come to the core of what is causing these things, you probably wasted a lot of time. And studies show that by the time a proper diagnosis of endometriosis is made, we're talking between 4 and 15 years. And that is a long time to be waiting. The disease has progressed. So yes, right now, let's say there's There's awareness. She's doing a beautiful job about it, and we're trying to get the word out there, but it's still not enough. I can imagine there's a woman in Samburu, there's a woman in Turkana who might still not know what endometriosis is.
So I'm just wondering, for you, Dr. as a gynecologist, when somebody comes to you and they're presenting all these symptoms and you can tell this could be endometriosis, seeing that with what Njambi has said, there's no treatment in the country, what do you tell them? What do you advise them to do? How do they go about it?
And so every patient is different, and it depends on how you are presenting to me. Okay, so Njambi's case is a bit, she had the very, I think, if I could say, the heaviest of them all, okay? Lung endometriosis falls in the category of brain endometriosis.
Wow.
And so you would need trained surgeons, cardiothoracic surgeons, and it would have to be a multidisciplinary approach.
Yes.
But the majority of women present with what we call genital endometriosis, where it's located in and around your uterus, which falls right on my lap. And so such a patient, I would offer the modalities, whether medical, whether surgical, would go through the motions. Should it step out of my comfort zone, then this is the point where you have to bring in someone else. I remember she talked of her appendix. The appendix is not a gynecologist. I would have to call in a general surgeon, you understand? If it touches on your brain, who am I to cut you open in your brain? I would have to call a neurosurgeon and a cardiothoracic surgeon, and basically all these people. Do you know what it means to say call all these people? The normal Kenyan can't afford it. It's money. Okay, it's money. You're paying a gynecologist for her surgeries. You're paying a cardiothoracic for her surgeries. You're paying a neurosurgeon for his surgery. No, this is a lot of money that the average Kenyan cannot afford.
Wow. So Njambi, I'm just wondering, in creating awareness, what are some of the stories you've had out there?
Oh my goodness! Oh my God! I get called every single day. Every single day. Women who are afraid, I think, when people saw my story, now that gave women a lot more power to come out and speak out for themselves as well. And I also get calls from women in the rural areas who have no access to gynecologists, but they feel the pain. I'm actually even just fundraising for a neighbor of mine who needs to undergo a surgery because they found out that she has, endometriosis, and it's been causing a lot of pain. It breaks my heart, because a lot of times when all these women are getting in touch with me, most of them are looking for finances. They're looking for a way to be able to pay for all these surgeries. And I know the pain, I know the burden, and I just wish that I had so much money to just pay for all of them. It's so expensive. It's so expensive, so expensive. And healthcare in this country is impoverishing people, and that's one thing we need to talk about. How all these diseases, all these chronic diseases are impoverishing people through fundraisers and all of that. Cost of medical care is expensive, and for something like this that that needs urgent care for most people is way out of reach. But I keep raising awareness, and I keep talking about it in the media, on my social media platforms. I actually have a song. I did a song. And it's on YouTube. It's called Rejection and Pain. And I wrote this song as a dedication to all the women who are battling endometriosis, and just to raise awareness. Another thing another thing that we also need to talk about is a sister disease to endometriosis called adenomyosis. And most women have endometriosis and
which
adenomyosis.
One is that?
I had that. I have that. And
we call adenomyosis, endometriosis, uglier sister.
Oh my God.
Yes, exactly. Yes. So
which one is
the
that
thickening of the uterus.
Explain to us which one that one is.
I'm not a doctor, but I guess Daktari will explain. But what I understand is adenomyosis is the abnormal thickening of the uterus, and it causes so much pain. You can't even sit down. You can't use the bathroom. It's a total mess. But Daktari can explain further what adenomyosis is.
Tell us.
Okay. All right. So adenomyosis, now the uterus. Allow me. I keep projecting this thing because this is my beloved organ. Okay.
Yes.
So the several layers. Endometriosis was the innermost layer that is shed off every month.
Yeah.
Then there's a muscle that holds that innermost layer, this thick thing you see. Yeah? And you know, a muscle feels nice and supple, but adenomyosis changes the consistency from nice and supple muscle to a fibrous, tough thing.
Ooh.
If you're chewing on meat, there's a very last bit that tends towards a tendon. You know that consistency, that fibrous nature. That's adenomyosis. And so you'd imagine all the motions of a uterus. It needs to contract to shed off a layer. It's contracting against this tough layer. And so if there's any pain that has ever been described so bad, it's endometriosis and adenomyosis.
Oh my
because
goodness.
endometriosis just enlarges the space where you're going to contract from, and then now adenomyosis gives the power to that contraction. And so the pain is probably out of this world.
Wow. I have a message here from Wamboi. Wamboi says, I had endometriosis since I started my periods at 13. The pain every month was unbelievable, and the bleeding was so much that I would get anemia. But I used to be asked to take painkillers. I had a very miserable life. I was diagnosed with endometriosis when I was 30. After all manner of treatment had failed. It had gone to my intestines and bladder. Luckily, I was able to get 2 babies at 31 and 33 through cesarean with a lot of problems, but after that, my uterus was removed. Although it affected my bladder, which was later treated, I'm happy as for the first time since I was 13, I was now able to go through a month without severe pains, and I now live a good pain-free life. And she says, yes, I had adenomyosis.
Adenomyosis.
Yes, she said she had that one too, and the pain was unbelievable. You know, I'm just listening to you ladies, and I'm thinking, hey, Sisi Wanaume, we have no idea what pain is.
You have it easy. You have it easy.
Yani, we have no idea. And sometimes we are so ignorant, because I'm just trying to imagine of a husband or a father who has a daughter or a wife who has this condition, and you have no idea. You know, sometimes you may end up saying very insensitive things.
And marriages collapse.
Marriages collapse.
And marriages collapse. Yeah, marriages collapse.
Oh my goodness. That is sad. That is sad. Daktari, before we run out of time, maybe back again, you can let our viewers know what are some key symptoms that somebody should not ignore where this condition is concerned.
Okay. The big one here is pain. And I always tell my patients, there's no medal for pain. What you think is little pain, just voice it out. Let me assess it for you. There is no medal for pain. So number one and biggest one is pain. Number two, and probably also pain in areas that may not necessarily or should not necessarily give you pain. Okay. Number two, excessive heavy bleeding. And by excessive heavy bleeding, I'm talking about if you're bleeding more than 7 days during a period, that is not normal. If you're expelling clots, madonge, that is also not normal, okay? If every time you're in your period, it has to be an affair that either you're admitted, either you're given extra painkillers, either you're given blood, that is not normal. And then now there are the isolated special cases. I once had a case where there was bladder endometriosis, and the girl, imagine a 12-year-old girl comes and tells me, every time I'm in my period, I also susu blood. So she was a bit scared in that she was thinking cancer. But all that tells you is there is, something else in that bladder that responds to a hormone every single month, which will be endometriosis. So I guess the isolated cases will be as you present. Every time you're in your period, you're coughing out blood, you're having chest pains. Every time you're in your period, you're fainting, you're vomiting, such things, okay? Difficulty during sex, pain. I mean, you should not have sex and have pain. It beats the purpose of having sex, right? So pain during sex is also a big flag. Infertility. Actually, a woman walks in with infertility. The first thing I go for usually, look at her tubes, do a laparoscopy. Is everything okay in there? Because chances are more often than not she has endometriosis. So basically pain, bleeding, infertility, and all the other symptoms that are associated with endometriosis in other areas.
Okay. There's somebody asking a question here. They're asking, does this condition end with menopause, or it still lingers on?
So menopause, it doesn't. I was going to say menopause kind of controls in the sense that you see, menopause is a switching off of a master switch,
the
hormonal master switch. But you see, the damage has been done over the years. So you may have to live with the decapitating effects of endometriosis even when the system has shut down and there are no more hormones to trigger. So you've had a lifetime of things that they are in, and lungs collapsing and pneumothorax. And so by the time we're reaching menopause, what quality of life is left? So you cannot say that you're free of endometriosis per se. You can just say it's a little bit controlled.
Okay. Okay. So Njambi, where are you at now? Are you completely free from this condition?
Oh, yes, I am. I'm good. I'm totally good. I don't have lung collapses. I don't have painful periods. In fact, because I've been going through a heavy medication in the last 4 months. 4 months. I was just sitting one day and my period came, and that we almost had a party in this house because we were like, what? Yes. Yeah. Because before my period came, listen, I would have to... I lived around pain. So before my period came, I would be in so much pain. So I know I have to have my medication. I have to have my doctors on standby. I have to sit with hot boiling water. I have scars from burning myself with hot boiling water in a hot water bottle. I have, I can't eat. So I just take water for the next 7 days. But now I'm able to eat during my period. I don't feel anything. I don't even take painkillers. And I thank God. I'm grateful to God. And most importantly, I have never had a lung collapse. Those things were traumatizing, very, very traumatizing. So I'm doing well, and I really thank everybody who has prayed for me and everybody who came through for me during the fundraiser. I'm grateful.
Okay, what's your parting shot?
Okay.
My parting shot is period pain is not normal. If you're experiencing any type of pain during your periods or right before, after, please speak out and seek help. Right now, there's a lot of information in regards to endometriosis. Hata wale wasichana wako mtaani, wale wasichana wako ushago, usiogope. And because our cultures and traditions and taboos wanatuambia, do not talk about menstruation. Speak about it. It's a biological function and it's necessary for reproduction. So we have to speak.
Daktari, parting shot.
I would say normalize your gyne visits, because then how then would you know you have a problem unless I clarify that what you have is not normal? So I would say a girl has a period, bring her in, let's have a chat, okay? Let's have a chat about this period, let's have a chat about this body. Normalize gyne visits so that you get to know what is normal, what is abnormal.
Great. Asanteni sana, Dr. Swabra. Njambi, thank you for your time this morning and thank you for creating awareness about this issue. Let's continue to soldier on. Njambi, asante. Your life is a miracle, my friend. Your life is a miracle. You have no idea. Many of us have just been following Yuki Sniper, praying for Yuki Sniper. But it's good
to telling her the same thing.
Yes, it's good to see you are able to talk. It's good to God is good. So thank you for agreeing to come on board today. May you guys have a great day and keep doing what you're doing.
You too. Maybe I should come and play some gospel reggae someday.
Yes. Maybe you should, Jambi. Thank you.
Maybe I should.
Yes. Well, that's all the time we have for Lifestyle Friday for today. Thank you so much for being a part of it. I pray that you have learned something. And I love what Njambi said in conclusion. Period pain is not normal. Let me add, period. Period pain is not normal, period. Honor Daktari. And let's talk about it. Let's talk about it. And men, let's also arise and champion some of these causes because our mothers, our wives, our daughters, our sisters are being affected. Let's not shy away from talking about these conditions. Why? Kabla tufike saa tatu, I've got time for one more thing, and that's food for thought with Professor Ndete. We've been talking about anxiety attacks, and we continue talking about that because remember, our mental health is also something very important that sometimes we ignore. So let's go to that.
Food for Thought with Professor David Ndete.
Now, it is said that as a man thinketh in his heart, so is he, meaning your mind is the most powerful thing to determine the quality of your life. Welcome to Food for Thought with Professor Ndete. Professor, talking about the stick that I have in my hand, for somebody probably who's never experienced a panic attack and they experience a panic attack, what should they do? Because this is something new, this is something foreign. You're thinking, am I dying? What is happening to me? how are they supposed to react or respond to this attack?
Yes, I was using the example of the state that I have in mind to emphasize this point that we are short of resources.
Yes.
So we as country, as societies, must learn to harness the resources that we have so that we can use them to bring the resource, to do something for these people. Mm-hmm. And the resources that we have the families. The family is very important. In fact, there's a very big movement that's going on now, and this movement actually started in the United States by a guy called Mesenak, a good friend of mine.
Yeah.
He's a world authority on this. And they are saying, for us to be effective, we must start with person-centered treatment. Person-centered treatment is a movement that is coming up in the United States.
Yes.
And is going global. We must start with family-centered treatment. What we are saying is, get people to understand what they are going through. Get myself, let me give my example. Get myself to understand what I'm going through and what I can do for myself in terms of managing the condition. Get my family to understand what I'm going through. Get my wife, get my children to understand what I'm going through. And once you start operating at that level, then you can do quite a lot. That's why I think, and I'm happy to be part of this process, because I am talking to families. I am talking to the individuals. I am not talking to doctors. I am not talking to nurses. Please, when you go to see the doctor and you face a problem, it is your right to ask, explain to me in simple language what is going on in me, what is going on in my child, because I would like to understand, and I would like to know how, as a parent, how, as a relative, can help. So I think to answer your question is knowledge. Give knowledge to people. Let people understand what's going through there.
Okay. Finally, Professor, what are some tips you can give us to help manage panic attacks?
To manage?
To manage it, yes.
Well, very good question. One of the things of managing, once you explain to them what is going on, is there are very simple techniques. There are techniques like relaxation. You can tell people how to relax, and you can tell them in terms of how they breathe in and out, how they can relax their minds. Relaxation techniques, there's very, very many of them. Relaxation, it means you are bringing that level of anxiety from that level to a much lower level. That one can be done. And many people in family situation, a patient can be taught to do that. The relatives can be taught how to make that person relax. And then there will come a time when these attacks are so huge in terms of their severity that you may need to use some drugs, and there are drugs that are available. And what those drugs do, there are two categories. There's one we call anxiolytics, without being technical. Basically, they go to the brain and act on that part of the brain that causes the anxiety, to reduce the amount of anxiety that is occurring at the level of the brain. But then, as I say, when people have these conditions, there are chemical changes that get out of their system, and they go to the level of the heart, they go to the level of the lungs, and they start breathing very fast, or the heart becomes fast, start beating fast, or they may have muscular pains. Then you can give a drug that you can give so that they stop those effects that are outside the brain, at the level of the heart, at the level of the blood vessels. Those medicines are available.
Okay. Finally, Professor, does panic attack have to do anything with personality types? Are there personalities that are more prone to a panic attack than others?
Well, let me answer this question rather indirectly. There are very many medical conditions. We know, for example, diabetes tends to run in families.
Yes.
Hypertension tends to run in families. Many different kinds of oncological condition tend to run through families, very many conditions. This is expected, given that even in these conditions, there are some chemical changes in the brain, and those chemical changes in the brain are mediated through genetic predisposition.
Okay.
So the same principle applies in any medical condition. It could be a panic attack, it could be anxiety, it could be depression, it could be any condition. So the message here is this: don't treat people with mental illness in a way that is different from other conditions, because the genetic predisposition is all over, even our personalities. The way, if you have a pleasant personality, 75% of that pleasant personality is determined by your genes. If you are an intelligent person and your IQ is very good, for heaven's sake, don't go boasting that I'm an intelligent person. You had nothing to do with it.
Yes.
You inherited it. Okay? It's only about 15% of this may be environmentally determined. So once we understand some of these things, then we take away the element of arrogance or pride. I am like this because I'm special. You are not special. Whatever you are, it was given to you. So that's the point that I am trying to make. And coming back to your question is, yes, it's an element of that, but it's general. But let's not just pick mental illness and say, you are like this because so-and-so in your family, you are like this. Then you start stigmatizing them.
Very true.
Are we going to stigmatize people with depression? Are we with the diabetes? Are we going to stigmatize people with the hypertension? Are we going to stigmatize people with all medical conditions for which there is a very strong genetic predisposition? This is just an element of stigmatization. Shall I say again, based on ignorance, because people don't know. And the fact that we are talking the way we are talking here, I hear many people will not say it's because of your background. Yes, there is an element of that, but it's all over. It's in all medical conditions, including our personality, including our intelligence, so and so on.
Wow. Professor, thank you so much for your time. We truly appreciate it. Remember, as I said at the beginning, that the quality of your mind determines the quality of your life. Let's maintain a good mental health. That's food for thought for today.
For this and more of our shows, log on to www.familymediaonline.com to enjoy a wide variety of programs, from current affairs to testimonials and features, pastoral and inspirational shows, kids entertainment, and so much more. Also stream live on www.familymedia.tv.